What to expect when visiting a chiropractor. Hey folks, I'm Dr. Jeff Williams. I'm the chiropractor and board certified orthopedic specialist right here at Creekstone Integrated Medical. And I'm here to give you some tips to help patients navigate the chiropractic waters and hopefully get a great one that really works for you. Many people have anxiety when they're facing any sort of medical or chiropractic visit for the first time. That's understandable since they're curious as to how the process will go and if there might be any complications, right? It might be difficult to know what to believe if you search the internet and find different reports, from best to the worst. If you go into your appointment with better knowledge regarding chiropractic, well, you're going to have a better experience and be less anxious about the process. Chiropractors are about movement, okay? Movement is healing. Movement in the spine and other joints, well, it's vital. These procedures are referred to by chiropractors as adjustments or manipulations. In the research, it's called spinal manipulative therapy. Easy for you to say, spinal manipulative therapy. And for many people suffering from lower back pain, sciatica, headaches, joint pain, or neck pain, a chiropractic adjustment is a tried and true method of relieving these symptoms. And chiropractic dates back thousands of years, to Hippocrates even. However, there are other aspects of chiropractic therapy than spinal adjustments. Chiropractors get extensive education in the treatment of bone, joint, and neurological system disorders, chronic pain, exercise therapy, and nutrition. They look at your nerves and spine and big joints to see how well they move and if there are any issues. So let's dive in on what to expect on your first visit to the chiropractor. In order to make sure you have a positive first experience, here are things that you can expect to happen during your first visit to a chiropractor. So why don't we start with the consultation and the history taking. Basically, a chiropractor or their assistant is going to sit with you to talk about your concerns, your pain, your issues, your complaints, and your goals before recommending any treatments. If you're there to get some relief from pain, they're going to want to know exactly where it is. How long has this pain been going on? What's the level of the pain on a scale from 1 to 10? Are you experiencing any other symptoms that could be associated? Your chiropractor can learn more about the problem and the best way to treat it from your answers. This consultation, it'll serve as a roadmap for the adjustments and any further treatment. It's even been reported in the research that 90% or more of a diagnosis can be gotten from the history, the intake, the questioning of the patient. Just your answers, lots of times, can lead right to the diagnosis, the majority of the time. For this reason, the chiropractor is going to want to know everything about your medical history and the medications you're currently on. The chiropractor wants to know whether you've suffered any injuries or similar injuries, any pre-existing medical conditions. What is your family medical history? Do you have any allergies? Previous and current treatments by other health practitioners, your lifestyle habits, such as sleep, diet, and exercise. Whether you partake in alcohol or any drugs. What provokes the pain? What do you do to make it better? And on and on and on. The chiropractor needs this information to understand what you came in for and how best to help you. If you're not being questioned about your health and condition history, leave and find another chiropractor, okay? It really is that important. Some chiropractors don't take enough time with their new patients to really figure them out. Now let's move on to the physical exam. Being an orthopedic specialist like myself, this is the part I particularly enjoy. This is where we really try to take all of the pieces to the puzzle and put them together in a meaningful way that makes perfect sense for us as providers as well as for you, the patient. After obtaining your history, your chiropractor will do a comprehensive physical examination. And that means your reflexes, joints, hip flexors, spine, neck, posture, how you move, that it should all be examined. General diagnostic procedures, including taking your blood pressure, your vitals, like pulse, respiration, and sometimes x-rays. We don't perform x-rays on all patients. Only those that present with red flags or concerns, they're the only ones that get x-rays, and that's about 10% of our patients. If you're not getting a comprehensive physical exam, again, leave and find another chiropractor who is comprehensive. Next, we create a treatment plan. The chiropractor will create a treatment plan after reviewing the test results. A number of factors are taken into account when we create a treatment plan, which include your age, sickness or injury, your general health, the frequency with which it occurs, the underlying cause of the disease or injury, how long your issue has been bothering you, and your specific other requirements you might have. After that, the chiropractor will discuss the potential courses of therapy with you and address any questions or concerns you may have. Treatment always includes patient preference. So hopefully you're getting an option of several different courses you could take. Now, after creating a treatment plan, treatment typically begins immediately, right there on the same day. Sounds of popping or cracking while the adjustment is made, those are normal, and you should not be alarmed by it. In fact, most people want to hear them. Some people feel better right after getting adjusted, while others, they may need a few hours or a few visits before they start to feeling better. Musculoskeletal pain is different. It takes time. Adjustments may be generalized or targeted at specific areas like the back, neck, or shoulders. It just depends on the complaint. Your chiropractor will make adjustments that are unique to your body and your specific needs and tolerance. After the adjustment, the doctor sends you to do exercises that are targeted to your specific issue. The chiropractor gets you moving on the joint level, then the staff will get your whole body moving with some exercises. Now remember, movement is healing, and those that are moving regularly, they get better faster, right? I always tell patients, if it hurts, it should hurt in a good way. If it really hurts, let me know. This should be something you enjoy, not something that you survive. Now don't be surprised if afterwards, after the first appointment or two, you get a little sore. Anytime you change the program, you can get sore as the body responds. If you haven't been to the gym in a while, the first time back, it's going to make you sore, even if you go light. But it should only be a little bit of soreness and should only happen the first time or two, if that even happens at all. A common misconception is that going to the chiropractor hurts. So let's talk about it a little bit. Adjustments, they're often, most of the time, painless. They feel great. However, some people may feel some discomfort if they're not accustomed to having their body moved around a little bit. Certainly, if they're already in a lot of pain, well, moving them is going to hurt a little. We tell our patients, like I said, if it hurts at all, it should hurt in a good way. If it really hurts, just tell us. We're not here to hurt people. We're not in that business. Chiropractic should be something you enjoy, not survive or fear. It should be great. You should look forward to it. Now, another common question we get is, how long before I see results? Well, after the initial adjustment, most patients report noticing a decrease in their pain almost immediately. It is essential to adhere to the chiropractor's prescribed treatment plan for the best possible outcome and long-term recovery. Healing can be achieved in as little as 1 to 4 weeks of 2 to 3 weekly visits, depending on the nature of the injury. But here's the key point. There's got to be some consistency. These are national guidelines. I'm not making these up. They're based on research through Clinical Compass. So don't give up on your body or your chiropractor too quickly. Healing and long-term relief, they need time, consistency, teamwork, and effort. You have to do your part too. Now, if we can help you, call us at 806-355-3000. Let's help you improve your life and get back on track. We see patients every day that are far too young to feel as bad as they feel. We love helping these people turn things around and get back into their lives, playing with their kids, and being active. If you're watching on YouTube or social media, we sure would appreciate a share, a like, subscribe, and maybe even a comment. All these things really help us get our message to more folks, which means we get to help change more lives in our community for the better. Until next time, I'm Dr. Jeff Williams. We'll see you then.